Okay, so this is about a 5-year-old child who has a nocturnal enuresis, and mother is quite worried about his son who is having nocturnal enuresis. So the consultant has explained to the mother, and consultant is going to the for the ward round, and he has asked you to talk to mother and to explain the mother about the non-medical management of the nocturnal enuresis and address whatever her concerns are. Okay, so mother name is Jessica and child name is John. So if you are ready, then I will start.
Yeah, I'm ready, no problem.
Okay. Good morning.
Good morning.
I am Dr. Hiren, one of the doctor here. I believe I am talking to Jessica, mother of John.
Yeah, doctor, I'm Jessica.
Nice to meet you, Jessica. Today I am
Yeah,
here.
thank you, doctor.
Today I am here to talk to you regarding John's condition, nocturnal enuresis, and about its non-medical management. So, Jessica, is that the right time to talk with you?
Yeah, doctor, no problem. I'm here for discussion only.
All right. Shall I start, or would you like to have anyone else attend with you this meeting?
No, doctor, today I'm alone. You can talk to me. No issues.
Okay. Jessica, before we start, what are your updates regarding John's condition?
Yeah, doctor, like my child is doing bedwetting and like it's quite distressing for us. Like every night he passes urine in the bed and otherwise no issues, like he's happy child and daytime there is no problem as such, but like we are worried regarding his like nighttime. So I thought there could be some medication for this so that you can help us for that.
Right. So that is a valid concern, Jessica. Actually, first of all, I'm sorry to hear about your son and the condition and the discomfort which your son, as well as what you are experiencing. Let me try to help you here today. I will discuss with you regarding the management. Before we start talking about management, this condition, nocturnal enuresis, in the children who are having age below 5 years, it is quite common. And
Okay.
gradually, once the children they grow young, in most of the children, this condition get healed without any treatment with a period of time. Are you with me so far? Are you with me, Jessica? Am I clear so far? Hello?
Yeah.
Yeah.
Yes, doctor. Yes, doctor. I'm following you. No problem.
Yes.
But like what can we do like for him now?
Yeah. So we have to do some change in the behavior by certain making some changes in the lifestyle before we start the medicine, because medicine
Mm-hmm.
the children who is
Mm-hmm.
having the age below 5 years is not safe, and it is not recommended also. So what we can do,
Okay.
some little changes we
Mm-hmm.
can do. First of all, don't give any water or the liquid at the bedtime. Number two, encourage him to take maximum amount of the water during the daytime, and try to encourage him and try to give him
Mm-hmm.
whenever he follows certain behavior, like taking a lot of water in the daytime and going to the washroom for the wee before going to the bed. These are some simple changes which we can make. Are you with me?
Yes, yes, doctor. Yes, I am with you. But doctor, like, how to restrict his water intake? He's a child. He will always keep demanding. Like, it's very difficult for us to put some restriction on him.
Yes, we can encourage him. I totally agree with you, Miss Jessica. The kind of the stress which you are going through about his condition. But if we follow some rewarding uh, change in the lifestyle, we can encourage John. For example, whenever
Mm-hmm.
he has a dry night and whenever he follows certain rules, give him a star.
Mm-hmm.
Okay,
Okay.
we should,
Okay. Okay.
yeah, we should not punish him whenever he wets the bed. Not punish.
Mm-hmm.
First of all, it is not
Mm-hmm.
the kind of the intentionally what he is doing, and it
Mm-hmm.
happens in the many children. So it is not his
Okay.
also.
So, so doctor, this is the only thing you can recommend to us, like water restriction and behavior, that appreciation of good behavior. Anything else you can recommend us apart from this?
Yes, apart from this, we can make some changes like make sure that whenever he, wherever his bedroom, make sure that in the night the passage to the washroom is clear and there is a light, and it should not be hard for him or stressful for him to go to the washroom. So you can make some modification in the bedroom, as well as there
Mm-hmm.
are like alarm also available whenever
Mm-hmm.
when you put this alarm, whenever he passed away the alarm rings, and he goes to the washroom. But before we go
Six
to,
minutes.
yes, before we go to this method, I advise you to follow, to start with something basic and easy steps. And
Mm-hmm.
once you are comfortable, or if you have any problem with following those steps, then we can consider for the alarm also.
Okay, okay, doctor. He likes too much of juices and all. So can we give those juices for him during the daytime?
Yeah, this is a very good point, Miss Jessica. I was about to talk on this point only. As you know, the juices have a high amount of the sugar and the calorie, and generally we should have to restrict the juices during the daytime. You can give him the juice if he likes, but try to avoid that juice in the especially bedtime or at the night time. And
Okay, doctor.
some more points also, like you can make him a habit of holding the urine. Also, you can
Mm-hmm.
advise some of the very gentle pelvic floor, like the butts muscle exercise, not
Mm-hmm.
in a large amount, but like a few steps, which I will give you the leaflet, which will be helpful to you about this, and by that way also
Mm-hmm.
can increase the
Mm.
holding capacity.
So, doctor, how long we have to uh, continue doing this? Like, when should we consider that this is not working?
Yeah, so generally, a majority of the children, when they grow above the 5 year, they get rid of this condition. But still, if it is persistent for more than 6 months, despite of taking these measures, then again we need to rule out some condition. As in case of the John, uh, there are no other conditions like any urine infection or any stressful situation or in the home, or there is no any other uh, constipation or other cause. But if if the John has persistent of this, then again we might need to rework up. But for that I need to talk with the consultant, and then probably he will review if it is still persistent, and we might need to do further workup also if it does not get control after taking all this
9 minutes, 9 minutes हो गया.
Okay,
9 minutes finished.
All right, so I would like to highlight the point if you don't have any other concern, Ms. Jessica. So we discussed today about uh, the nocturnal enuresis. We discussed about the how to manage without the medicine, and we also discussed about the basic change in the lifestyle and some of the changes in the home, how it can be helpful to manage this condition. Meanwhile, I think I gave you a lot of information, Jessica. I will give you some leaflet about this condition. And still, if you have any question, you are more than welcome. We can arrange a next meeting for if you have any further concern or the questions. Thank you.
Thank you, doctor. Thank you.
Thanks, Ms. Jessica, for your time, and I wish John a very speedy recovery from this.
Okay, thank you, doctor. Stop alarm. So, Dr. Hiren, it was good. The information introduction. That this part is little improved, like introduction to agenda. This part is better now. Like we are taking less time as compared to previously. Yeah, like still 1.5 minutes you took, but okay. Like previously more than 2 minutes you used to take. Okay. So it's good. Secondly, information was good. Like it was structured and broken in multiple parts. I thought you forgot regarding the holding behavior and keeping the passage to the bathroom well lit, but you took those points later. It's good. In the first thing you said, like I'm here to discuss the non-medical management of nocturnal enuresis. So this is jargon, like they don't know nocturnal enuresis. Like we can say bedwetting instead of nocturnal enuresis. We are here to discuss the management of or your concerns regarding the bedwetting. And little sentences are still longer. There you have to work. Last 3 minutes I asked you a question, like you could have been shorter for that. Like when I asked like how long we have to wait with this management, like then you can say like we will follow him regularly on the OPD, and after 6 months we can review him and we can discuss further. But the explanation went very long. That there you finished all your time and could not conclude the scenario. But it was overall it was good.
Okay. I was just having little like this scenario, they have mentioned the other causes excluded. If it is not mentioned, then we have to also talk about UTI, constipation, psychological depression, school bullying. Because children, they could have any of these reasons like organic causes, right? But here they already mentioned that it is excluded.
Right. Regarding that medicinal management, like it is absolutely contraindicated before 5, or we can give in certain situations.
Now the next scenario is that is about the medical management.
Sleepover wala.
Yeah, I read from that one leaflet. They say up to 6 year they don't start sleepover. Yeah, the one which is
Cannot hear.
Okay.
Yeah.
So
cannot hear you.
Hello. Now is it clear?
Yeah, now it's okay.
Okay.
Yeah.
They say up to 6 year you should not start. Okay.
Right.
Then for the just for the purpose of a sleepover, they are like mentioning certain points regarding the desmopressin. In that, they said you have to first of all explain that it is available in the sublingual and the oral tablet, 60 milligram, 100 milligram, like that tablet comes. Then you need to tell like before you start using, first you start using, your doctor will advise the correct dose, then you should practice first at home before you start, whenever you go for sleepover. That's called like a kind of a home run practice. That's the word they used. And after that, you need to explain the reflex about that medicine desmopressin, which is like whenever there is a swelling in the body, whenever there is a headache, sleepiness, confusion, drowsiness, all these are the red flag signs. Any of this happens, you
Right.
need to contact the doctor, which is probably because of the fluid overload because of desmopressin. Then there is
Yes.
a like a question like if it vomits, what should I do? If I give the tablet and if the child vomit, you should not give another dose, even if the child vomits.
Okay.
And there is a
Okay. Good.
come like yes, I forgot to give 1 day before. So the next day I should give two tablet. No, you should not give two tablet. If you forgot, we will consider as a missed dose and will give just regular only. And
Yes.
about the yeah, these are the like main expected
Also,
red flags in the
also,
yes.
also once you take the tablet till next day morning he passes urine, you should not give
Yes,
liquids.
yes, yes. And after that, water also we should not give. Once he
Right.
take the tablet and he takes the water, after that should not give a water or any liquid.
Dr. Harin, can
Yes.
you share this leaflet?
Uh, okay, I will share in the. It is given in the this.
And for your communication, I have also, before starting the next communication, give me please time. I have to add one point as a
Yeah,
comments
yeah.
of your communication.
Yeah, 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 yeah. Sure, you can.
Okay.
You can comment now,
Should I
Dr.
tell now?
Fatima.
Yeah,
Yeah,
yeah.
yeah.
You can come.
Dr. Hiren, I have seen many people using this sentence that in this short time I have given you a lot of information. I think you speak Hindi and I can understand. I speak Urdu, and in Urdu if we, or Hindi, if you say to some person like that, मैंने आपको इस थोड़े से टाइम में काफी सारी मालूमात दे दी हैं. I think it doesn't look nice. Initially, it was my own thought, but then I was attending the meeting with the Dr. Noor, who is from UK, and I think she is very good in her communication skills, especially if we see in the scenario of the UK communication in this. I have tried to. It doesn't look rude. If you say I have given you the information, to some extent it looks rude. So it's my own thinking, and I have discussed with one or two person who have given the exam. They also were of the same opinion that we should try to use the sentence. I have tried to give the
Mhm.
information in this short time, but we can arrange another meeting.
Yeah,
Either we can add another sentence, but we should use the word कि हमने अपनी कोशिश की है, हमने अपनी
yes,
तरफ
yes.
से try किया है.
Yeah, that is good suggestion. We can use
Yeah.
the one you said. Like I have tried to give you the suggestion or the best information, whatever I can give it to you.
Yes, yes,
But still, we
yes.
can
It is
still
also nice
arrange
what
another meeting.
whatever I can.
Yeah,
Yes.
yeah, that's a
If
good suggestion.
we don't say this, if time is short, and if we don't say that we can another arrange another meeting, even then it will cover our point of view that in this short time I have tried to give the best information what I can.
Yeah, right, right. Okay. Any other suggestion,
No, this was the only point. And the other
okay.
points Dr. Sandeep have covered.
Dr. Rohel, any other point you would like to add?
Sorry, boss. I have patience.
Okay, okay, fine, fine. All right, so um, like it can, if it is a sleepover and
Yes,
desmopressin.
only one thing I want to add. I did not listen totally completely your scenario,
Mhm.
but a few things which I felt that you are giving the information. You are not checking with the Sandeep, with the mom, that her understanding. So because this scenario is only, there is no questions in this. They can ask you the question, doctor, how can I resolve this issue? This is the one only. Then they can ask, doctor, he love to drink more water, how can I avoid this one? The third issue, we are going for excursions, so in the night I am going to visit my parents, so it will be very unacceptable as a socially, it will not be good for me, so give me some medicine. Like these three questions only they can ask you. Or other question, they can ask you about, is there any abnormality in the this urinary system, p system?
What you will suggest
So
if the mother asks, I want to go to my grandparents' house,
yeah,
and the
then
doctor,
you can give desmopressin for for this. Yeah, you can use desmopressin nasal spray.
no, this
This,
is, I think, will be considered wrong information because
no, no,
5 year, below 5 year, they are below 6 year, they are saying no. And if
no,
it
no.
is,
You are not giving for as a medicine. You are giving just for a short period of time. That you can use. If you will check in the this guideline, I will also check today. You also check
because
for the
I
short period.
reviewed 2 3 leaflet, there I could not find. So generally in the practical life also, what those children who have a bed wetting, you simply take the the pampers or the diapers with them, and you use that instead of trying a desmopressin just like without, because desmopressin, once you start, you need to adjust the dose, you need to make a, they said the word specifically used in the mark like home run practice, and then you can start
Mm-hmm.
desmopressin. So short basis for 3 days.
I will check.
Yeah,
I
you
will check
you
again
check and
today.
share, no problem. Yeah, you check and share because I could not come across. I did not see anywhere. So maybe you are right. I could not found it. Okay,
Okay, okay.
so okay, so you are talking to parents, Mr. and Mrs. Wilson. Okay,
Mhm.
whose child, who is a 6-year-old child, and
Mhm.
who is a case of hereditary spherocytosis, and who has a splenomegaly. The doctors decided to do the surgery for this, and the pediatric surgeon has talked to the parents about the surgery plan, and
Mhm.
also explained to them about the possibility of the blood transfusion during the surgery and about the possibility of the blood loss during the surgery. Now, surgeon has left and he has asked you, you are on duty registrar, he
Mhm.
asked you to talk to the parents about the possible blood transfusion and take a consent from the parents. And both the parents, they are having a witness of Jehovah.
Okay. 6-year-old child's name is?
Child name is Jack.
Okay.
Once you're ready, I will start the time.
Okay, I'll start. No problem.
Okay.
Okay. Good morning.
Good morning.
I'm Dr. Sandeep, one of the doctors working here, part of team managing your child. Are you Mr. and Mrs. Wilson, parents of Jack?
Yes, doctor. We are,
Okay.
yes.
Yeah, nice to meet you, Mr. and Mrs. Wilson.
Nice to meet you too,
So,
doctor.
Yeah, thank you. So today I am here to discuss regarding the plans of surgery and the possible need of blood transfusion with you. Is this good time to talk to you?
Yes, doctor.
Okay, so shall I start, or you want someone to be with you in this meeting?
No, it's okay, doctor. We can start.
Okay, Mr. Wilson. Uh, can you tell me what have been told to you up till now regarding Jack's plans?
Yeah, the doctor, the surgeon who talked to me about they decided to do the splenectomy surgery as
Mm-hmm.
he's having this condition called hereditary spherocytosis. And surgeon
Mm-hmm.
said
Yes.
about the possible blood loss, and he
Yes.
also told me that he may require the blood transfusion. But doctor, we have taken an oath, and we are having a witness of jehovahs. So I am not comfortable with the blood transfusion. God will take care. I'm not agreeing with
Mhm.
that point.
Yeah, Mr. Wilson, I can understand your religious sentiments and your refusal regarding the blood transfusion. But I'd like to tell you here that this is a major surgery, and during the surgery, the blood loss can be very significant. And if blood loss occurs, then it can be life-threatening to the jack. Like sometimes there can be major event that can occur. So the surgeon have told you that Jack may need blood transfusion. Are you following me, Mr. Wilson?
Yes, doctor, but you can use the other saline instead of the blood. I have no problem if you use a saline.
Uh, Mr. Wilson, I appreciate your knowledge, but the possible thing, like, we will try our best. The surgeon will try his best to minimize the blood loss, and the need of the blood transfusion, they will try and avoid that blood transfusion. And initial period, they will manage with the saline and some blood expanders. Like they can use some special salines also. Like they can use, like one of them I can mention, that they can use albumin. However, in the rare cases, when the blood loss becomes very significant, then the blood is the only thing which we can give to the child.
Okay.
Are you following me, Mr.?
Yes, yes, doctor. But I heard there is a sale saver, there is another this process
Yeah, yeah.
they are utilizing, and the
Mm-hmm.
other way of using
Yes,
this
Mr.
instead of the blood.
Yes,
Does
Mr.
your
Wilson.
hospital provide that facility?
Yes, Mr. Wilson. You are very correct that we have one procedure that is called as that. In that procedure, we save the blood which lost during the operation, and we can transfuse it. But however, the quantity of that blood might not be sufficient, and we can definitely try that procedure. But if it is insufficient, and if their life-threatening situation arise, then the blood transfusion will be the only option available for Jack to just save his life, because we are here in the best interest of the child, and we will do our best for the Jack.
And doctor, other thing also, since the jack is very small, and like I have heard this blood transfusion, sometime the donor's blood
Mm-hmm.
might have, the like virus like HIV, hepatitis B, lot of infection. I heard sometime it also causes some kind of allergic reaction after giving the blood transfusion. So I'm not in a fear of this, doctor. If I go, this jack might have this chances of infection as well as allergic reaction with blood.
Mr. Wilson, I understand your concern and really appreciate your knowledge. However, the transfusion practices has become very safe in the recent times. Each and every pint of blood is screened for the various infections, like as you mentioned, HIV and other viral infections. And regarding allergies, we have expert team. If any allergies comes up, if any allergy comes up, then we can manage with some medications. However, in life-threatening conditions, if we don't give the blood, then it can like it will be can be dangerous to the Jack's life. So in the rare conditions, we may need to consider this transfusion. Uh, we will try our best. The surgeon will try his best to minimize the blood loss and the need of
3
transfusion.
minutes remaining.
Yeah, and
Okay. Yes.
Mr. Mr. Wilson, I would like to tell you that if you refuse the transfusion, the surgeon also might reconsider his decision operating the jack. Then in that case, we might have to refer you to another surgeon. That will again delay his procedure, Mr. Wilson. Are you, are you following my point, Mr. Wilson?
Yes, doctor. But see, Jack is my son, and I
Mm-hmm.
have a full right to decide about uh, whether he needs transfusion or not. And
Mm-hmm.
what you will do, doctor? You will cancel the operation if I tell you no about blood transfusion?
Mr. Wilson, we need to discuss this with the surgeon, and in case he refuse to do operation on the grounds of the need of blood transfusion, then we will try to refer you to another surgeon who is comfortable to operate without your consent for blood transfusion. However, in case this need of blood transfusion arises during the surgery, then we have to consult our ethical committee, and sometimes we need to take some legal advice regarding the blood transfusion to save the Jack's life, Mr. Wilson. Am I clear so far, Mr. Wilson?
Yes, yes, doctor. But
Because
doctor,
Jack,
yes,
because Jack's because Jack's life is the prime importance for us, and as a parent, you have his responsibility, but we have the responsibility of saving his life, Mr. Wilson.
yes, yes, doctor. And what about
Okay.
this infection, doctor? This hepatitis B and HIV, this all can happens because of
Mr. Wilson, Mr. Wilson, as I have mentioned, that each pint of blood is screened for the infection. So chances of getting infection, these viral infections, very less. And the benefits of transfusing in emergency situation are far more than the chances of getting blood infections. So uh, it is better in case of life-threatening conditions that we give him blood.
okay,
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 Mr.
doctor.
Wilson.
Okay.
Okay, Mr. Wilson, I have tried my best to give you the best possible information. If you allow me, can I summarize the various points which you have just discussed?
Yes, doctor.
Yeah, Jack is plan. Jack, we have plans of this splenectomy for Jack, and as you are refusing to the blood because of your religious sentiments, I have explained to you that we will try our best to minimize the blood loss, and we may try cell salvage therapy. However, in case of emergency and life-threatening condition, Jack may need blood transfusion. However, you are not ready, still ready. I have also explained to you that we may need to take legal advice in case there is the life-threatening condition arises, and we'll discuss further with the surgeon regarding the further plans. Is that okay with you, Mr. Wilson?
Yes, yes, doctor.
And thank you for your time, Mr. Wilson. I wish all the best for Jack.
Okay, okay. Thank you. Okay, Dr. Sandeep. So, your introduction, agenda, and closure and content also was good. Only few correction, right? Like one thing you said, you will refer to other surgeon. So
Yeah,
don't.
actually, I read in. Yeah, I will share you the leaflet. I have that leaflet. It mentions that Yeah, as the parents have the right to refuse the blood transfusion, the surgeon, if not comfortable, he can refuse the procedure. Then you have to consult to the another surgeon.
But if he
Yes.
asks only, you come out with
Mhm.
this. If I
Okay.
don't ask you, don't
Mhm.
refer to other
Yeah,
surgeon.
yeah. I volunteered the information.
You
Okay.
volunteered actually. You create a
Okay.
grave.
Dug my own grave.
That is one thing. And about infection, the like possible complication of the blood transfusion, you have to say like we do. I mean, we make a proper double check for these. We also make sure like donor and recipient both checking so that the
Yeah.
infection occurs very
Cross match.
minimal.
Yeah, cross match. I did not mention.
Yeah, we do also the cross matching, and the chances of reaction are also very less. But still, if it happens, we do monitor after even the transfusion, and we can control it.
Right. Correct. Important.
And the third thing is about management. Little bit show like something if during the on the table if severe blood loss happens, then it can be a very life threatening in which like the worst outcome can happen. So the whole hospital committee as well as the surgical team, they decide whatever the best interest for the child in favor of child. That is the only things
Mm.
which
Right.
to some extent you mentioned already.
Right. Yes.
Yeah. Otherwise,
Actually,
it was good. Yes.
yeah, it was like it's more of negotiation actually.
Yeah. More
Not
of
much
negotiation.
information.
Yeah.
Mm.
Yeah. So
Anybody else? Like
we have 1 minute.